Hello everyone, I'm Barb Doyle, the Director of Marketing for SurgeryPRO, a Southern Connecticut company. And we're here today with Chris Huffnagel, who is the Northeast Territory Manager for InControl Medical. So today we have with us Chris from InControl Medical, and we're glad to have you with us here today, Chris. Chris is here to introduce to us the Intone Device, which is a brand new device for the treatment of female urinary incontinence. So welcome, Chris. Glad to have you here.
Great to be here.
Good. So can you spend some time telling us a little bit more detail about what the Intone device is?
Yeah, absolutely. So it just so happens that I have an Intone right here.
Great.
So this is a personal trainer for your pelvic floor. Any woman that has stress, mixed, or urge incontinence can use this once a day in the privacy of her own home, and it's pre-programmed for 12 minutes. It does 2 minutes of volitional exercises, so Kegels, and what will happen is when the woman squeezes on the device with her pelvic floor, basically it'll register here. And actually, why don't I just show you how this works briefly, and then that way I can demonstrate it for you.
Okay, great.
Actually, so why don't I demonstrate the Intone?
It is now time to do your pelvic floor muscle exercises.
It actually talks to you.
It does.
Device by applying Intone Gel.
So it tells you to put gel on the tip and on the silver stimulation contacts.
Insert
Okay.
Intone gently.
They'll insert Intone to the base of this balloon here.
After
Okay.
insertion, press bulb and inflate balloon until comfortably snug as instructed by your clinician. When ready to begin session, press the start key.
So essentially what you'll see is the design of this. This is an ergonomically designed handle so that you can insert the device to the base of the balloon. This bulb right here is a pump so that the balloon can expand until it fits comfortably into each woman. The black button here is to release the air at the end of each session. So once the device is in, you can start your program. Does that all make sense?
It does. I have a couple of questions, though. Is that it kind of one size fits all, if you will?
Sure. So currently the Intone device, well, it's not a one-size-fits-all product, as the balloon allows it to fit many different women. The actual size and shape of the device, this is the only device currently on the market. There will be a smaller device available in the future that will be narrower and shorter for any woman that cannot accommodate this particular device as it is engineered right now. Typically, most women, any postpartum female, has no problem accommodating the size of the device, and it actually only goes in 10 centimeters.
Okay, that makes sense. Another question I had when you were just speaking about it was, you mentioned gel.
Yes.
Can you use any gel with the device?
Yeah, that's a great question, Barb. Actually, you cannot use any gel. There is a specific electrode gel that you would use with your Intone, and the reason that you would use that gel versus some other lubricating gel is because the gel that you use, that we will provide you with, actually conducts a very low level of electricity from the stimulation, and that helps to amplify and deliver the stimulation much more effectively than other gels.
Okay, that makes sense. Now, you spoke a bit about it's for women who have stress incontinence, urge incontinence, or mixed incontinence. Now, I would imagine that the protocol might be different depending upon diagnosis. Can you say a little bit about that?
Yeah, sure. So that's a very logical question. Essentially, the program, it's pre-programmed for 12 minutes, and it doesn't matter if you have stress, mixed, or urge incontinence, it's the same program. And the reason being, if you have stress incontinence and not urge or mixed incontinence, essentially the low-level stimulation that is delivered for the urge incontinence patient will not hurt the stress incontinent patient, and vice versa. The higher level stimulation that would be delivered for the stress incontinent patient will not hurt the urge incontinent patient. And for mixed incontinence, obviously it's ideal because it treats both. It's actually one of the very few therapies out there that actually does treat both stress and urge incontinence.
Okay. So, side effects.
Sure. Currently, there are no negative reported side effects with Intone, which is pretty amazing, and it's over 90% efficient.
Wow, that is pretty amazing. Have there been clinical trials? What's the research? What's the basis here?
Sure, certainly. So biofeedback and electrical stimulation has been around for 40 years or so now. And there's a lot of published research documentation showing that both biofeedback and electrical stimulation are effective therapies for treatment of incontinence. Currently, with regards to Intone, we have a number of research studies that are in process, the first of which will be published in August of 2013 here, and it will show over a 90% efficacy for every patient in the study that either had stress, mixed, or urge incontinence.
Okay, that's great. Spend a little time telling me a little bit more about the biofeedback part. I see that looks
Sure.
pretty sophisticated there. What would the physician have to do to get that ready for a patient?
Yeah, absolutely. So the beauty of Intone is that essentially it's designed for the patient to use it in the privacy of their own home. They'll come in initially to get set up in office, and they will be shown how to use the device. And so essentially, if this were already inserted and already pumped up, the patient would see a number. That number is their baseline number, so each time they use the device, they just pump it up to that same baseline number. Everybody's baseline number is going to be slightly different depending on kind of the size or the shape of the woman. And essentially what happens is once they have their baseline number and they're comfortably snug, all they'll do is they'll hit the start button,
Intone will begin by taking
and it'll take a
measurement of
baseline
your
resting
muscle
pressure.
tone. It is important to lie still with your abdominals, legs, and buttocks relaxed. Do not move Intone during this time. Intone will begin your measurement now.
And then it will begin the
Intone
therapy.
will now guide you through a pelvic muscle toning session. You will complete 3 short contractions followed by a longer contraction. It is important to maintain a relaxed breathing pattern and to keep your abdomen, buttock, and leg muscles relaxed while exercising. Between each contraction, allow your pelvic muscles to fully relax to avoid fatigue. Let's begin. Contract your pelvic floor muscles now.
So as they contract the pelvic floor muscles, they actually see active
Relax muscles
biofeedback,
and
visual
breathe normally for
biofeedback
10 seconds.
on the bars as they light up. It's a 3-second quick flick, 10-second relaxation,
Contract now.
3-second quick flick, and as they squeeze, you see the bars light up, and then when they relax, the
and
bars
breathe
go away.
normally.
So it's 3 seconds, relax, 3 seconds, relax, 3 seconds, relax. Then it does a 10-second long hold. So this is the active biofeedback portion where the patient is voluntarily squeezing their pelvic floor muscles and strengthening them utilizing the device. So it's 2 minutes of volitional exercises. Then there will be a subsequent 5 minutes of electrical stimulation where essentially the device strengthens the pelvic floor for the patient by actively contracting their pelvic floor muscles, and also will actively calm their overactive bladder over time. So it's 2 minutes of volitional, 5 minutes of electrical stimulation, and then an additional 5 minutes of volitional squeezing, where they're actively doing their Kegels. The reason that this is so much better than just doing a Kegel without the Intone is because this balloon technology allows the pelvic floor to fully contract, and it provides active resistance, so it strengthens the muscle group much better than if you were squeezing on nothing, or if you were squeezing onto a rigid probe. And so after the 12 minutes, this automatically shuts off. The patient deflates the device, takes it out, goes over to the sink, pumps it up, and simply washes the end of it with soap and water, dries it off, puts it in their nightstand or under the bed or wherever, and then uses it again the next day. So once a day for 12 minutes.
Okay, so sounds relatively easy. Most people would be able to go through that process. Once we send that person out of the doctor's office with the device, having been trained in the doctor's office, correct?
Yep.
Do we follow up again with the patient?
Yeah, so actually, very unique feature to Intone, and this is wonderful for clinicians out there. If they were to prescribe Kegel exercises and told the patient to go home and do their Kegels, there's no way that they can actually tell whether or not the patient was compliant with doing their Kegel exercises. There's also no way to tell if they were actually doing those Kegel exercises properly. So what's wonderful about Intone is this personal trainer for the pelvic floor records every single thing the patient does when they're utilizing the Intone. Shows that they use the device every day or not. Shows a baseline resting tone of their pelvic floor, so the weakness or the strength that it's currently at. And then it shows a measurable progression in PSI, so the pounds per square inch, of the strengthening of the contractions of the pelvic floor over time. And it basically just shows you the averages over time, so it can actually, not only will the patient have symptomatic improvement of their leakage, reduction in leakage, but you'll also have documentation of the strengthening of the pelvic floor that will correlate with that reduction in leakage.